Hey guys, it's Paula Nutting, your musculoskeletal specialist, and I'm so proud to be able to introduce one of my patients or my clients, Wendy, and she's been to me twice, and this is our third visit.
It is.
Yeah. So Wendy came into me, I'm not going to say train wreck, but I'm going to say train wreck.
I was.
Yeah. So she'd fallen, had a huge fall and fractured of the upper part of the humerus.
That's right.
And a dislocation of the shoulder.
Yes, and it dislocated that humerus out as well.
Yeah. So how many months ago was that?
It was February, so we're almost at 6 months.
Yeah.
Almost 6 months. Yeah.
So about 6 months, she's had orthopedic surgical intervention, or not surgery, but they did a...
It was under the care of the surgeon. They had to put the joint back in, and I was under the care for him while I was they did that and recovered from that.
And has had physiotherapy and some great allied assistance to get her through the journey of that post-trauma. Has come to me through a wonderful guy, Sandy Clark. Shout out Sandy Clark, great chiropractor, but also functional neurologist, which is why we get on, because Wendy had really limited range in that shoulder, yeah?
Yeah, I did.
So can you tell us about the range? How was it?
Well, it was poor for me. I was very locked. I was doing everything that was requested of me from the allied health professionals, but I just was stuck and I couldn't get any further. And to me, it wasn't so much I couldn't feel pain, but I was very stuck. So I couldn't get my arm up quickly. When I did, I was fatigued quite easily. So that's where I was at.